Hi, guys. Welcome back to another episode of the Chronic Chronicles. I'm your host, Lexi Halloran, and today we're diving into the fascinating world of naturopathic medicine with a guest who's dedicated her career to holistic health and empowering patients on their wellness journeys. As a naturopathic doctor, she combines the wisdom of traditional healing practices with the latest in medical research to provide professional, personalized, natural treatments that address the root cause of health issues. Let's welcome to the show, Dr. Alexis.
I'm Dr. Alexis Gonzales. I go by Dr. G. I'm a licensed naturopathic doctor in California and also certified in functional medicine, and I specialize in endometriosis.
Yay! I'm so excited. So, just to throw the first question out at you in the most polite and nicest way possible, I know that when I personally see a naturopathic doctor as my primary physician, and I know when I tell people that, they're like, "Oh, you see like a hippie doctor." So, and then I have to like explain to them that they're credentialed and they go to medical school and all of this stuff. So, I'm just kind of curious from like your side of it, what kind of schooling did you go to? What do you tell your patients when you are kind of like explaining like what you do? So what is a naturopathic doctor and like what kind of schooling do you go to?
Yeah, so a naturopathic doctor is, we go to a 4-year accredited medical school and we do all of the same basic science classes that you learn in a conventional medical school. So biochemistry, anatomy, physio. And in addition to that, we have a really strong focus in herbal medicine, physical medicine, and then we nutrition as well. And then we also spend a lot of time just focusing on how you can effectively communicate with patients. So what we refer to as a therapeutic alliance, which is, I think, what a lot of people look for in a naturopathic
Hmm.
doctor. We also take board exams just like a conventional medical school. The biggest difference in regards to training after school is residency isn't required. I chose to still do a 2-year residency because I felt like the additional clinical practice was necessary. And really, I was so appreciative because that's how I got into primary care and realized that there were all these patients coming in with undiagnosed endometriosis and kind of was really the starting platform for how I ended up specializing.
Okay. Yeah, that makes a lot of sense. And I've done some research on naturopathic doctors as well. And correct me if I'm wrong, but it kind of seems like most naturopaths end up working like kind of in primary care anyways. So I feel like that might be a reason as to why residency may not be required. Whereas like traditional MD programs, there are so many different specialties that you could go into that I feel like residency is important in that because if you want to go into like cardiovascular surgery, yeah, doing a residency, you don't learn necessarily all of those skills. Well, you don't learn that in medical school.
Right.
So doing a residency makes sense for that. Whereas it seems like anyways, a lot of naturopathic doctors do go into primary care or some type of like chronic medicine.
Right.
Um, so yeah, it would make sense that, like that's what you're learning in med school anyways.
Right.
Um, Cool. So what residency program did you do? You did functional medicine, right?
Yeah, so I actually had a very unique residency program where it was a dual residency. So I was working in a busy integrative functional medicine clinic where we had physical therapy, acupuncture, massage. It was a functional medicine insurance taking primary care office, which was really awesome and fairly
Ooh.
rare. And then my other part of residency was actually working at the Institute for Functional Medicine, where I still work, where we are actually, on the team, the medical education team for creating medical education materials to help train other doctors in functional
Mhm.
medicine and help them get certified. So that was my residency program for 2 years. So really it was the best of both worlds because I got a little bit of clinical practice and then was also able to stay up to date with the research and
Yeah,
really help spread the message and help other doctors, open their eyes up to this new way of practicing.
that's really cool. That sounds like a good residency program.
It was awesome.
So what exactly is functional medicine?
Yeah, functional medicine, what I like to think of it is, my training in naturopathic medical school gave me a lot of skills and tools about how to practice. Functional medicine really provides the system for me to integrate that with conventional care. So really, I have all these skills and these tools, but to be able to know actually how to personalize it per patient and how to apply it in a systematic way that's still flexible,
Hmm.
depending on what the individual needs are for a patient, is really what functional medicine provides. And what I also like to say is because there's so much confusion around naturopathic medicine, as you start to train and, functional medicine really attracts providers from every specialty. So whether you're conventionally trained, whether you're a cardiologist, a gastroenterologist, whether you're a health coach, naturopathic doctor, chiropractor, it provides kind of a similar language where we could speak to one another and really understand. And it really is a shared goal of trying to get people to get better and stay better throughout their life.
Hmm.
So that's what I really appreciate about functional medicine is it's really providing long-lasting solutions that are able to evolve with the patient throughout their life.
Yeah. Yeah. I love that. I mean, that right there is why I searched out a naturopathic doctor is kind of just for that language in itself. Like I saw MDs, I saw DOs, and I feel like every different type of doctor has a place in medicine. Like I needed an MD or a DO to help me do the surgery to see if I had endometriosis. But I feel like treating the chronic, long-lasting effects of endometriosis, I haven't really started feeling relief from that until this past year when I started seeing my naturopathic doctor, which
Wow.
is kind of crazy. And I don't know if it's because like I really don't know what changed, honestly, but it's working. Can you share a little bit about your background and kind of like what led you to becoming a naturopath?
Yeah, it really, so for naturopathic medical school, I originally wanted to be a plastic surgeon and
Hmm.
was very committed to that path and really just shadowed a few doctors and they were
Hmm.
very clear with me that the work-life balance would be difficult, obviously possible, tons of people do it,
Yeah.
but was going to require a little bit more dedication. And then was introduced into naturopathic medicine and saw a naturopathic doctor. And I don't think I had ever spent longer than 10 minutes with a doctor ever.
Yeah.
Maybe I got my physical, occasionally just because there's a lot of stuff to do in a physical, but it was honestly so therapeutic just to be able to talk and have a dialogue with somebody. And that
Hmm.
was pretty much sold me that I wanted that face-to-face interaction and I wanted the ability to really dive deep. And I'm a very curious person by nature. And so to be able
Hmm.
to provide that space to be curious about someone's health and then to also answer questions for someone's curiosity about their own health was just really the dream job for me. So
Yeah.
that's really how I was called to naturopathic medicine.
Okay.
Hmm.
Yeah. My naturopath that I see right now, I think our first initial appointment was an hour. Like and I mean she was in there with me for probably 45 minutes of it, which
Yeah.
is honestly pretty impressive. And
Yeah.
especially, I mean, as you know, somebody with endometriosis, like you just have such a long list of things that have happened. And when like that initial intake appointment, it's always I've moved around a lot. It was always really hard for me getting a new doctor because I would get like 15 minutes and I'd
Yeah.
be like word vomiting everything. And I'm like, did you get all that? And then I would leave and I'd be like, that nothing happened in that first appointment because I only had 15 minutes to like word vomit the last 10 years of my life.
Yeah.
And because like the last 10 years is all relevant to my endo stuff.
Yes.
And it was nice in that like actual 45-minute appointment when I could sit down and be like, oh, okay, like this happened, this happened, this happened. And then they're actually like taking notes and they can ask, there's time for them to ask questions for like further. It was nice. And I think that was probably the only doctor's appointment where the first appointment I went home with like something.
Oh, I love that. And
So,
that's my appointments are 75 minutes long.
oh my gosh.
And most of my patients will tell you that we usually run over that first appointment just
Hmm.
because, it's hard to talk about
Hmm.
all of your history and unfortunately, a majority of it is fairly traumatic, right?
Hmm.
In regards to the answers that you're getting, the answers you're not getting, the confusion. And so to then add on an element of having to rush someone through that, I just don't think is very therapeutic in and of itself, right?
Yeah.
And I personally think it's impossible for me to get all of the information I need in a very short period of time, right? Because there's
Yeah.
questions that come up from new things that you bring up, and it's interesting because patients will suddenly have their story that they're telling, and then as we start to ask questions, they'll start to remember other things that they think may
Hmm.
be connected, and that to me is just the most beautiful thing because no one knows your body better than you do. It's just my job to help facilitate that connection and help you make those connections with your health
Hmm.
history. And really, that takes time and it takes a dialogue and it takes a really
Yeah.
lengthy conversation.
Oh my God, I love that. I'm envious of your patience
Oh,
because that sounds amazing. And I wish that, I don't know, there's a line for me because I'm like, okay, obviously I don't want to shit talk any doctor. Like I truly believe that everybody goes into medicine for like a common reason that they want to help people. And unfortunately, the way that our healthcare system is set up
mm,
for most doctors, it's not set up for those kind of conversations. You know, like there gets to a point where, and I've seen it happen, like as I know that you and I had an initial conversation a while ago, and I talked about how I wanted to go to medical school and I like worked in medicine and all this stuff. And I definitely saw it happen where you kind of start out with this treatment plan that you want, and then you get knocked down a couple pegs because of what insurance companies will pay. Um, and I don't think that's the doctor's fault necessarily. So it gets difficult. I don't want to shit talk doctors, but um, yeah, I think that that's great what you're doing, and um, it definitely, I don't know, I feel like I almost got to the point where I had like a rehearsed amount of information that I would give because I'd be like,
yeah,
okay, this is what these are like the big things that I can give in 15 minutes and I can like spit it out and hopefully they hear it all. And
right.
then in 6 weeks when I come back, I can try to give them more.
Totally. And I think that is also a really important part of what are really the management plan is with a lot of my patients is how do we make the
Hmm.
most of those 10 minutes that you have with that doctor? And really why I really am a strong believer in a collaborative care team because like you said, there's a role for each of your providers in the
Hmm.
type of care that you deserve and what you need. And yeah, I'm very sympathetic towards other providers. I've worked in a really busy insurance-based practice and reimbursement is really tough for providers. And
Hmm.
one of my friends recently said, you know, we doctor really hard for our patients. And it's true because someone comes into you with all of these issues and questions and confusion. And when you only have 20 minutes to spend with them,
Hmm.
it's hard not to go above and beyond in the treatment plan because you just want to try to help them as much as possible.
Yeah.
And the other thing is a lot of doctors have, also have their rehearsed treatment plans and what they need to get done in a certain period of time. And so I just think setting expectations early that this is
Hmm.
the appointment that these are our goals for this appointment. And if you don't get what you want, this is what we're going to work around to help you get what you need is really what I always counsel patients on because I'm not a primary care provider anymore, unfortunately. I've moved out
Hmm.
of that space, but I still think having a functional medicine provider or a naturopathic doctor on your team is really critical
Yeah.
because then you do have that allocated space to be able to talk at length, get your answers or your questions answered and whatnot.
I really do like that too. And I do think that like more recently when I go into my appointments, I do have kind of like a plan of things that I want to talk about. And I'm like, okay, well, these are the things that I'm trying to figure out. Like, I feel like I've had this laundry list of symptoms for years that I'm like, I don't even know. It's almost been like, I don't know, like an example, a couple of years ago, I had this weird like fainting spell spree. Like every once in like I had never fainted before, and all of a sudden, I don't know, like every couple of weeks, I'd faint
Oh,
randomly, and I'd be like, okay, I don't know what's going on. And there was this one time that I was driving and I could like feel it coming on. Like I never would pass out just completely out of the blue. I could almost like feel it happening before and I'd be like, oh, okay, like I'm gonna pass out.
Yeah.
So there was this one time that I was driving and I could kind of feel it coming on. It would almost feel like, have you ever gotten, I think it's a CT scan where you get contrast
I
and
have.
it feels, okay, well, when you get it, it feels like really warm all throughout your body and it kind of feels like you're gonna pee.
Oh, yes.
That that's what it would feel like before I would pass out. A little bit, like not as harsh as that, but it kind of
Yeah.
would like I'd get like warm all over and I could like kind of feel like my cheeks flushing and I'd be like, "Oh, I feel weird."
Yeah.
Well, happened one time when I was driving and I was like, "Okay, maybe it's time for me to go to the like hospital because I obviously like don't want to pass out when I'm driving."
Right.
Um, so I went in and then I thought maybe it had something to do with I was having high heart rates. They had just found out that I had a mitral valve prolapse, like I don't know, a year prior to that. Of course, like the emergency room doctor is like, "Well, you're not passing out now, so you're fine." Okay. So then I go back to my primary care doctor and I'm trying to talk to them about this. And I'm like, could it have anything to do with like I saw a cardiologist? Could it have anything to do with this? Could it have something to do with my endometriosis? Like, and then my primary care doctor is like, well, all your levels look fine. And I'm like, well, there could have been like a few months prior to that, they saw like an abnormal thyroid level, but then they retested it and it was fine. And I'm like, it seems like things are weird.
Right.
So it may not be weird right now, but like things have been happening. And then they're like, well, maybe you should go see your gynecologist for your endo. Is it something to do with your endo? So then I'm just getting tossed around to all these
Totally.
people.
Yep.
And I go see my gynecologist, and she's just like, oh, well, it's anxiety. Like you're passing out because you're getting anxious. And I'm like, but I'm like, there's no connection to it though. Like
And
I'm,
what? What do I do about that?
yeah. And I'm like, okay, I, even if it is anxiety, like so what I'm driving and I get anxious all of a sudden and then I pass out. Like, what am I supposed to do? Anyways, never got resolved, but it's like things like that. So then now I'm trying to kind of like go back on all these things that have happened over the years with my naturopathic doctor now. And like at every appointment, I'm like, okay, like I've had these things happen. Could it be something else? And now my naturopathic doctor and I have been talking and she's like, you still have like I wear an Apple Watch every day and I literally like showed her the report out from it and she's like you still have like high heart rates randomly. So she's like you may not be passing out anymore, but do you still feel like that like pre-syncope? And I was like, yeah, like I get that sometimes and then I feel like my heart's kind of like fluttering so then I have to sit down and she's like, yeah, so now we're kind of talking about like POTS. And she's like, I think you might have POTS. And I'm like, why did no one catch us years ago? Like, this is what's frustrating to me.
It's so true. And I think the difficult thing is to go back to your point with the current healthcare system is
Hmm.
you're trained to label something and then that label triggers what your treatment is supposed to be.
Right.
And to me, a diagnosis is really such a blip in someone's health journey, and not to minimize the importance of it because then it gives you access to care. But
Yeah.
really, that is why naturopathic medicine and functional medicine are so critical, is because you have that diagnosis and then you ask the question, why, right?
Hmm.
Is what are all the factors from your surrounding and your environment and how you're perceiving the world? Why is that happening suddenly? And why
Hmm.
is, it suddenly becoming noticeable to you? And that is really where the long-term management key usually lies, because once you address those underlying factors, then it's not really this pill for an ill, because then you could see how quickly things could stack up really quickly,
Hmm.
right? If you're just kind of putting out a bunch of mini fires instead of trying to
Yeah.
figure out what's causing them. So it's super frustrating and yeah, the toss around
Yeah.
is very common, unfortunately.
No, it's super, super common. So, and I feel like, at least almost every single person I've talked to with endometriosis has definitely been tossed around for a long time. And I feel like it's almost like a coming of age thing. Like you start to get older and you like put your foot down. You're like, okay, no, like I'm not going to the next specialist anymore. Like we're gonna just stay here and figure it out.
Right. That is
I know. I feel like the older I've gotten, the more I've just gotten like firmer in who I am. So I'm just like, okay, actually, no, like I'm not gonna go to this person. We're just gonna figure this out. Yeah. So can you kind of explain what your approach is to treating endometriosis, or like what does your practice look like? Say I'm coming in as your patient with endo
Right.
or potentially endo. What happens?
So usually we have a 15-minute, just what we call an exploration session where I kind of learn about what your goals are, what you've tried, what your current care team looks like. And then it's a huge teaching piece about what functional medicine is and how it supports an endometriosis management plan. So that's usually a big education piece is really, I'm not there to treat. I'm not a surgeon, right? I'm not an
Hmm.
endocrinologist. I'm not an OB-GYN. I'm there to just help you manage all of the things and fill in the gaps as to what's not being addressed. And also, I like to think of myself as a quarterback in that you're getting the toss around, but I'm helping make sure that's very strategic. And I'm also your biggest advocate. So if we're going to send you to a specialist, let's send all your chart notes ahead of time. Let's get in contact with them. So that way, when you get into that 15-minute visit, they should already have had all of your information. There's
Hmm.
lots of follow-up. And then we spend 75 minutes. I have a lot of paperwork, as you probably know with a naturopathic doctor, those intake paperworks are pretty extensive, where we talk
Hmm.
about your menstrual history, possible environmental exposures, dental history, even surgical, all the basic stuff that's usually on an intake questionnaire. And then we spend the 75 minutes talking about what your life has been like since you were in utero, what your mom's like was like while she was pregnant with you, your family history. We go through a timeline from age 0 until your current age, and then we really hone in on what your goals are. And that is really the guiding light for what the management plan looks like. Usually the three paths are, I'm not sure if I have endometriosis and I need to figure out if I do. I'm getting ready to have surgery because I know that I have endometriosis either on ultrasound or it's been clinically diagnosed by my OB-GYN, or I've had a previous surgery, or I'm getting ready to get pregnant, whether that's through assisted reproductive technology or just trying to get pregnant naturally. So those three treatment plans usually start out, or I'm sorry, management plans usually start out fairly similarly, where we just try to get a good idea of what the foundation is, usually through labs. Um, and then, I wish I had some very standard endometriosis protocol, but I'm tweaking every single part of that management plan for every single patient because it's just so different.
Yeah.
Everybody presents really differently. Everybody has different resources available to them, time, money, energy. And usually what it involves is making sure that you are nutritionally repleted, because if you don't even have the building blocks to metabolize your hormones, to manage inflammation, to support
Hmm.
your immune system, that's going to make a lot of the other things, recovery from surgery, getting pregnant, managing symptoms, a lot more difficult. And then once we have a good foundation, then we can start to get to the nitty-gritty of hormone balancing, dysregulation, and
Hmm.
inflammation.
Okay. The comment you just made about nutritionally repleted. What
Mhm.
exactly does that mean? How are you looking at that?
Yeah, so when you think about your body, especially with endometriosis, it's almost like you're running this machine all the time without any breaks. And this
Hmm.
machine, I really mean your immune system. So when we talk about inflammation, inflammation is really rooted in the immune system. It's an immune response in response to
Hmm.
something that's foreign or that the body is signaling to the body that's not supposed to be there. And so that requires a lot of nutrients, B vitamins and minerals that quickly get depleted. And then when you think about all the digestive issues that are usually connected with
Yeah.
endometriosis, plus the stress, plus the fatigue, plus the pain medications that you're usually taking, it usually means that you're prioritizing a lot of other things besides eating a very food first therapeutic diet, which is right the appropriate thing to do, because when everything's a priority in your life, it's easy to kind
Yeah.
of off the easy stuff. And so usually the most common things that I see depleted are things like magnesium, B vitamins, minerals like zinc and selenium, And so vitamin D is also another really common one, omega-3
Hmm.
fatty acids. And so we talk about a lot of those. You see those a lot on Instagram as being useful, but really I like to think of those as just being very foundational nutrients that I would love to prioritize just getting from food. And so
Yeah.
that's really the first step is getting your digestive system in a good enough place to be able to absorb everything that you need from food, just so your body can do what it needs to do on a daily basis. And the great thing is all of those nutrients are really important for hormone metabolism and detoxification, supporting pregnancy, a healthy pregnancy, ovarian health. So we're literally trying to get the biggest bang for our buck with food by just giving you more nutritious meals or
Yeah.
supplements in some cases.
For me, I had like this is not a diss on my mom at all. She's great, but she was very young when she had me and she worked in medicine. So like she's a respiratory therapist. She would do random shifts every once in a while. And growing up, it was also in like the early 2000s. It just wasn't the healthiest food,
Yeah.
right? And I mean, we just like didn't really eat vegetables growing up. I also was a very picky kid, and I don't know. I honestly don't know if it was like my mom wasn't feeding me those things or if I just refused to eat them. I have no idea. But I, like, up until I was 17, my boyfriend and I started dating then, and he eats everything, like, has always eaten everything. His family eats everything. And I remember when we first started dating, I went to dinner at his parents' house, and I don't remember what they made, but his mom made me like separately
Oh,
because
that's so sweet.
Tyler, my boyfriend, like had warned them, was like, she doesn't eat things. I don't remember if like I don't remember if he said this to me or his parents did, but somebody was like, like, I'm not gonna make you separate food every time, basically. And I was like, okay, like I'll try things. Like I really didn't think I was that picky. Like everyone around me ate those things. I was like, whatever, it's fine.
Right.
In the time we've been together like 9 years now, and I eat a lot of things now, but in that time, I think majority of food I hadn't even tried. He was like, "Oh, here's some asparagus." I'm like, "I've never had asparagus. Like, I don't know what that is." The vegetables I ate were like green beans with ketchup, and I think that's it.
Yeah.
Corn on the cob. Like, I
Yeah.
didn't really eat a lot of nutritious things. And I also had my gallbladder taken out when I was 15, so I felt like there were a lot of like food triggers for me. For some reason, McDonald's was fine. I don't know how that's possible, but like I could eat McDonald's and it was fine.
Yeah.
Yeah, so it took me a long time to kind of come to terms with the fact that like nutrition and food could flare my endometriosis and like eating a more nutritious diet could help it. And even to this day, I'm trying to eat more just healthy food, like, but I haven't eaten a lot of those foods growing up. So it's kind of like I try to go towards like a more Mediterranean anti-inflammatory diet. A lot of that is like avocados and tomatoes and stuff like that. And I don't like those things. So I'm like trying to force myself to eat them.
Totally.
But yeah, it can get really difficult. So
I totally hear that. My grandparents immigrated here from the Philippines, and so I'm a second born generation.
yeah.
And my mom was born in Canada. And so when I was growing up, we were eating very traditional Filipino food, which is a lot of stewed animal products with like everything in there. So pretty high saturated fat, obviously lots of rice,
Okay.
lots of
Hmm.
bread, lots of sugar. And when you're growing up, and you're going to school, you don't want to eat that food. And I grew up in the 90s, so it was like Lunchables and those
Yeah.
like little cold pizzas that you were like obsessed with
Yeah.
making. And just like I just wanted the plainest food. And I just wanted to be like all the other kids. And then I also ate a lot of McDonald's because to my grandparents, it was like the greatest deal on earth, right?
Oh
To be able
yeah. Yeah.
to feed a family of four for, less than $20, which is not the case anymore. But
No.
um I would say like in the spectrum of like really holistic and like
Hmm.
very conventional, I'm very realistic, right? I just think
Hmm.
food in my family is really a love language. So
Hmm.
to me, healthy eating is really having a very diverse diet. So to your point, that's usually one of the things that I talk about with my patients is are you eating the same things all the time? And what can we
Hmm.
switch up? Because really diversity in your diet and really with produce and protein and fats is
Hmm.
what really contributes to a really healthy microbiome. And I think just having those simple tips in mind can help kind of dull a lot of the nitty-gritty details about saying,
Hmm.
oh, you need to have this much flaxseed, or you should only have ground flaxseed, or you should have flax seeds, or now we're not doing flax seeds. And, it just
Yeah.
gets very confusing. So if you can just have a really diverse diet and really learn to enjoy what you're eating, I think is a really big goal that I have a lot for a lot of my patients. And by the time they see me, most of them are on very, very restrictive diets, usually by
Mm.
things that they've eliminated on their own. Or a common thing that I see is most patients will be put on an elimination diet. And what
Hmm.
I always tell people is it's an elimination challenge diet, right? You're supposed to
Yeah.
eliminate things with the intention of challenging it to determine if you have a reaction to it. It's
Yeah.
not an elimination just so you can fully take it out. Obviously, there's special case uses like celiac disease or if you're lactose intolerant, but um, it's always a goal of mine for patients to be able to eat freely because there's a lot of delicious food out there. So I don't, I want people to also partake.
Yeah. I think that for a long time, I mean, I remember like years ago, my gynecologist was like, okay, like studies have shown that dairy, gluten, sugar, those things are inflammatory. So, which they can be, preface, but like that's not necessarily true. But back then, my gyno had told me you should just cut all those things out and you can't eat them. And for me, somebody who is like 100% addicted to sugar, like I love sugar, and I grew up in Michigan, love dairy, love bread. Like I was the kid that would, you could ask like any of my elementary school best friends, I would literally only eat bread. Like I would go to school and I would get like white bread and I'd roll it up into little balls and then
Oh
eat
yeah.
it.
Oh, that's the
It was
best.
so weird, but I loved it. And people would be like, "Is that all you're eating?" And I'm like, "Yeah, piece of bread. I love it." So I'm like looking at my gynecologist when I'm like 20 and I'm like, "You are trying to kill me." Like all of that is everything I like in life. So I was like, "I'm not doing that. No." Um, but never once did anyone say, like you can have those things again. We're just trying to figure out if it flares your symptoms. Until
Right.
recently. Recently, my naturopathic doctor is like, like you've been saying that you've been having a lot of bloating lately and you can't get your bloating under control. Like we can talk about maybe cutting out one thing at a time for a little while and then adding it back in. And I'm like,
Love
wait, I
it.
can have it again?
Right.
And she's like, yeah, like we gotta see, we gotta test it, like see if you actually are having a reaction to it. And I'm like, oh, that makes so much sense. And I'm over here like, I have a master's degree in science and I like do research all the time. And I don't know why I couldn't like think of that. Like, why?
I mean, it's so hard when it's your own, when it's yourself, right?
Yeah.
Because you are taking in so much information that you almost need somebody to objectively help you make those decisions.
Hmm.
And I feel like exactly what you said, to me, it's a disservice to people to not explain why you're doing something, right?
Hmm.
Because
Yeah.
I always think of when I present a management plan, I have to get buy-in from the patient, right? Because if they don't really know why we're doing certain things, and there's a lot of stuff that we put on the management plan, then they're probably not going to do it. Because if you don't know why you're doing something, then the motivation to do it, just because someone's telling you to do it, usually is not there.
Yeah. Yeah. No, that's very, very true. And I feel like especially with things like endometriosis, like chronic conditions like that,
Oh yeah.
you want to be doing things that are actually achievable long term. And if the patient doesn't want to do those things, like you can make a great treatment plan or a great management plan all you want, but if you're telling it to me and I'm not saying that I'm actually like willing to do that, then you just wasted your time. Like there's no point in doing that.
It's so true. And I think it's funny too, because patients will come back and they're almost won't tell me if they didn't do something on the management plan, because that's always part of our follow-up is what worked, what didn't
Yeah.
work, what did you like, what didn't you like. And that's really important to me because if something's not realistic for you, then
Hmm.
me continuing to suggest it to you is almost a dismissal of what you're trying to tell me as a patient, right?
Yeah.
Because your life is what the ultimate goal is for patients with endo to get back to the lives that they want to get back to. And that includes going on vacation, that includes eating, home cooked meals from their family members, that includes eating birthday cake with their kids, like all of these things that are deeply personal and meaningful that they're just unable to access just because of endometriosis and not being managed appropriately.
Yeah. And I think for me, it has just come with both age and like having endometriosis for like over 10 years now. Well, technically, I've only been diagnosed for like 6, but in reality, like dealing with it for so long, I had my naturopath put me on, I think like 3 or 4 supplements, but I am historically bad with taking pills, medications. Like I'm not good at it. Like I don't remember. And then I get like frustrated with myself because I'm like, it's literally taking a pill. Like it's not that hard. I don't know why I can't remember to do it. But and I didn't tell her that. I was like, okay, yeah, I'm good with the treatment plan. Like this is what I want to do. The problem was is that she put me on these supplements 3 times a day,
Oh,
which
wow.
was not an easy thing. So then like 6 weeks later, I went in and I was like, you're gonna be really mad at me. Like I've only been doing it once a day. And she was like, no, it's fine. Like if that is what you can do, then that's what you can do. But 3 times a day would help more. And then she's like, can you work up to that? And I'm like, I don't know. Like it is, especially when you're at work all day, like just remembering to like go and I don't know. And then she's like, oh, we'll just take them with lunch. And I'm like, you say it like it's easy, but for
Yeah.
some reason, I don't know why I can't do it.
It's true. And I am admittedly not a great supplement taker, even being
Hmm.
in the field that I'm in, but I feel like it helps me just, I get it. It's really
Yeah.
tough. And then capsule fatigue is a real thing, if you are just constantly pushing on your stomach acid to dissolve through those capsules, plus your
Hmm.
medications, plus you're really stressed, so you're probably not digesting things as well. That can be really, really tough. And then you don't get the results that you are looking for from taking a certain
Yeah.
supplement, and then that can contribute to frustration. So I usually like to do a lot of botanical tinctures or powders that you can
Ooh.
add into smoothies just to kind of change it up, and where we
Yeah.
can things in if the supplement load starts to get fairly heavy. But I'm right there with you. It's another thing that you have to do every day, and
Yeah.
it's a lot harder than it looks to stay consistent.
It definitely does get difficult. And then I like get frustrated with myself because I am very type A and I like make to-do lists and typically I can get through them, but then I'm like, oh shit, I took my vitamins this morning, but I didn't take them this afternoon
Yeah.
or this evening, or I can like take them in the evening, but then I miss them at lunch. Then I'm like, I can't check that off my to-do list now because I didn't actually do it. And I
Exactly.
just get frustrated.
Totally.
Okay, so couple more questions just about like naturopathic medicine and endometriosis in general. What do some of these like management plans kind of look like? Like I know we talked about nutrition, but what else do you normally like incorporate in those?
Yeah, I'll try to make it simple because it's very different and very
Yeah.
personal. We usually try to target the three main areas, which is rebalancing your immune system to become reactive at the right things and ignore and just finish the projects that it has left unfinished. And what I mean by that is when you have multiple endo lesions around your body, your
Hmm.
immune system gets very confused. And it's normally a very, very sharp system that recognizes things that it needs to get rid of and ignores things
Yeah.
that it doesn't. And that dysregulation can sometimes contribute to things like autoimmune diseases where it starts to recognize self as something that's foreign. And then the other part of that is it starts to let things in that also contribute it to being more reactive. So that's a really big part of our management plan is balancing your immune system. We use a lot of herbs to do that. There's also lots of nutrients like minerals that are really important for balancing the immune system,
Hmm.
and antioxidants are really important. And
Hmm.
those really tie into what we would consider an anti-inflammatory protocol. And even that is really tough too, because when we start to get into the fertility piece, there's actually an element of inflammation that's required for endometrial receptivity. And
Hmm.
so that is why I really like patients to see doctors before they start supplements because it really is still a medication in a
Hmm.
way, and that it's manipulating your physiology for a very particular goal. And so those little nuances are really important. So balancing your immune system, addressing inflammation, and then the hormonal regulation piece, is really, really important. And it's very different per patient. So
Okay.
estrogen dominance is usually a common hormonal
Hmm.
pattern that we see with endometriosis. And estrogen dominance really has two arms to it, whether progesterone is just not sufficient to balance out estrogen. So, meaning you could have normal levels of estrogen, but there's just not enough progesterone to balance it out. So, it is the dominant hormone,
Right.
or estrogen levels are really high, meaning that it is just at a higher level and dominant, even though your progesterone may be doing okay. And that is a multifaceted management plan in and of itself, right?
Yeah.
It's, we get rid of hormones primarily through the stool. And
Hmm.
so if your ability to have a bowel movement is impaired, or you have dysbiosis or an imbalance in your gut microbiome, we have to address that because that's a really important source of recirculating estrogen back into the bloodstream. So that's when you'll hear about terms like beta glucuronidase, which is an
Hmm.
enzyme that's produced by your gut bacteria that actually
Hmm.
kind of what we call uncouples or gets estrogen ready to be recirculated back into the bloodstream. We also work on that either by giving bioidentical progesterone if you're trying to get pregnant after ovulation, just to support those progesterone levels. And then while we do those things, we try to figure out why there's some dysregulation with how the hormones are being produced. So if there's lots of endometriosis lesions that are producing estrogen on themselves, that's
Hmm.
usually when we'll reach for things like aromatase inhibitors, but natural versions. So things like fiber, just to help reduce how much of that estrogen is being converted. And we think about the contributing factors to why estrogen is being upregulated, and inflammation is one of the big drivers of that. So I think those are kind of the main areas that we like to address with a
Yeah.
functional medicine approach to endometriosis. And why patients with endometriosis, I think, seek out this type of medicine is because you can see how many more options you now have besides just getting rid of your estrogen or shutting that down or
Hmm.
eliminating the conversion to estrogen with an actual aromatase inhibitor like Arimidex or anastrozole. So rather than just cutting off that pathway altogether, we can take a step back and say, okay, how can we just manipulate that pathway in a more gentle way to really make sure that you can, have a long-term solution.
Yeah. Yeah, that's super, super interesting. It's just everybody is so different too, so it makes it very, very confusing. And especially when, there's just not that much information out there, like publicly. Hi, Chronic Chronicles fam. Do you ever feel like your period is ruling your life? By now, you all know that this is a common occurrence for me. Feeling like endometriosis, my period, hormonal imbalances, all of this is just completely in charge of my life. And that's why I'm super excited to introduce to you Some Days, a game changer in period care. Whether you're dealing with, cramps, fatigue, or general body aches because, your girl gets really bad back pain on her period, Some Days also has your back with products designed to bring you comfort and relief when you need it the most. Why Some Days? Because they understand that every body is unique and every period is different. From soothing balms to herbal teas, their range of products is really thoughtfully crafted to help you manage your period with ease and confidence. Plus, Some Days is founded by a fellow endo warrior, Lux Perry, so you know it's made with empathy and expertise. Join me in embracing a better period experience. Check out Some Days and take the first step towards a more comfortable, empowered you. Don't miss our exclusive discount for Chronic Chronicles listeners. Use code Chronic Chronicles at checkout. I don't know. Some of the comments and questions that I've gotten from the podcast, Instagram, and like TikTok and stuff are people who, I don't know, I'll just ask you a couple questions. So I've got a lot of questions about blood sugar regulation is a hot topic.
Mm-hmm.
gut microbiome, like
Mhm.
supplements to help with that because people have said that, like scrolling on TikTok, gut microbiome is a hot word and blood
It's
sugar
true.
regulation is a hot word. And then just supplements to take in those settings. And then they, somebody asked a question about it had to do with blood sugar regulation again. What was it? Let me pull it up.
Okay.
It had something to do with blood sugar regulation and your immune system.
Hmm.
They said, I feel like I've been struggling with blood sugar regulation and I also have a really low immune system. Could this be due to endometriosis? Very
Oof.
vague or not vague question. That's a hard question. But personally, my non-medical background, like that feels very similar to me. My whole life, I've struggled with, I get sick very easily. For example, I got influenza last week. My boyfriend, healthy as can be, he slept next to me all week and he did not get sick. And that's like a constant thing. I get sick. I travel to Michigan for the weekend and I only sleep 6 hours instead of 8. I'm sick.
Right.
So I'm like, okay, well, that's obviously like I have a low immune system. And then I've also had some like blood sugar things come up in my blood work. So I'm like, oh, okay, like I have endometriosis. That actually makes a lot of sense with me too. So I know that that might be a hard question to answer, but
I will do my best. So it's a little bit of like chicken or the egg there. Like, did the blood sugar
yeah.
regulation and immune imbalances cause endometriosis? Is the endometriosis contributing to both of those things? I usually like to always explain it in a bidirectional relationship. So
Hmm.
to just speak to the blood sugar piece directly, there's a lot of pieces there. So usually when we think about blood sugar, your body is really good at lowering blood sugar because the sugar in your
Hmm.
blood makes it kind of sticky. So there's some pretty immediate mechanisms by your body to help lower and take that sugar out of the blood, with that main hormone being insulin. And
Hmm.
so when I think about blood sugar dysregulation, I usually think about it in the context of, is your insulin just being pumped out repeatedly, trying to lower the blood sugar, which is the appropriate response and what we want. But the issue becomes then the pancreas, which is the organ that produces insulin,
Hmm.
is really, something that will tire out eventually. And that's how you get to these stages of insulin resistance, pre-diabetes, type 2 diabetes, where it slowly becomes less efficient at
Hmm.
producing insulin itself. So in that regard, its connection really to endometriosis is twofold, really. When we think about insulin and insulin resistance, there's usually an underlying inflammatory component, which is how we kind of connect it back to endometriosis because
Hmm.
we're in this chronic inflammatory state,
Yeah.
which makes insulin less sensitive or less likely to bind to its receptor and do its job. So then you pump out even more insulin to kind of saturate those receptors and again, try to lower the blood sugar. The second part to that is insulin and a protein called sex hormone binding globulin work inversely. So
Hmm.
if your insulin is really high, your sex hormone binding globulin is low. The sex hormone binding globulin binds to estrogen in the bloodstream and makes it less active. So it isn't able to do a lot of its active activities in the body, which can be
Hmm.
beneficial for something like endometriosis, right? If we want a lot of that sex hormone binding globulin around to kind of bind up a lot of that active estrogen. So that is really why managing blood sugar and lowering insulin and increasing sex hormone binding globulin can be actually beneficial from a metabolic perspective.
Hmm.
But again, right, we have to rather, of course, we want to address things through diet and lifestyle, but we have to always recognize that there's an underlying physiologic imbalance that's happening that makes the choices that you're making in your life not as responsive and why it can be frustrating. And that education piece is really, really important because
Hmm.
you have to stay consistent with the diet and lifestyle. But if you understand that we're also working on that physiologic imbalance with supplements and other stronger interventions, then you know that the consistency and the response will happen slowly over time. The great thing about blood sugar dysregulation is it's really responsive fairly quickly. So even within a month of someone who has really high insulin levels, we can see those levels go down and see the metabolism
Hmm.
start to become more balanced. So I always use that as a point of empowerment. Like even though we have these abnormal labs and even though there is blood sugar dysregulation, it's one of the few, one of the mechanisms in our body that responds really quickly to what we do. And then to the gut piece, that's also chicken or the egg with the endometriosis,
Hmm.
right? Are you having some issues with digestion and just moving things through the body because there may be adhesions in the lower colon that are preventing things from moving really easily? Are you
Yeah.
just having lots of food reactions because you're just not digesting things that as well, which can contribute to bloating and discomfort and then make it really painful to pass a bowel movement. So then you don't feel like
Hmm.
eating as much because, sitting in the toilet and sweating and almost passing out for a lot of patients with endometriosis is traumatic. And then if you think of
Yeah.
have to do that multiple times throughout the day, your gut reaction is to try to avoid that experience by trying to minimize
Hmm.
how often that happens. So again, the gut is also one of those really responsive things to diet and lifestyle, but there's so many nuances and there's so many different things that can happen. And it's so different depending on how your digestive symptoms manifest. So that's like, I feel like a whole separate episode. We could just talk about
Yeah.
gut health.
Oh my God, no, I would love to have you on again just to talk about gut health, especially like I actually made a TikTok, I don't know, like a month ago, and I was like, anybody who specializes in gut microbiome, gut health, like I want to talk to you because like I have a master's in bacteriology and I've always been like, there's 100% a connection between your gut microbiome. If you have irregularities, if you have too much bacteria, too little bacteria, it 100% affects endometriosis. And there's not a lot of research that necessarily says that in those terms. Like there's a lot of research that says, a whole bunch of things, but it doesn't
Right.
necessarily say that. And I'm like, I would love to pick somebody's brain about that. So we
I
should,
know
we should
it's
definitely do that.
fascinating. And when you really recognize that the gut is your interface really with the outside world and really your immune
Hmm.
system's first interaction with the outside world, I think you start to really realize how powerful it is. And really
Hmm.
everything that's happening in your gut is communicating to the inside of your body about what you're putting
Yeah.
in, what you're exposed to. And you can, once you realize that, you can manipulate it in a way that serves you, which I think
Hmm.
is really cool.
That is really cool. I love that. I know that we have to start wrapping up. So, do you have any final thoughts or messages that you'd like to share with everyone or about managing endometriosis through maybe a functional medicine approach?
Yeah, I would say if you're not sure if you have endometriosis or you think you do or you do have
Hmm.
it and you are unable to get surgery or you're on your path, I just really, really strongly encourage you to find some type of functional medicine or holistic practitioner that can help you manage everything with you because
Hmm.
it's already a very isolating experience, as many patients know, and as anybody who has a chronic illness is aware of. And so having a healthcare provider that's on your team that's an advocate for you makes a huge difference. And doctors
Yeah.
usually listen to other doctors, unfortunately, a little bit more. And so having someone really to work on the back end for you makes a huge difference. And number two is, I always set expectations that functional medicine is a slow medicine. And so by the time you see somebody, right, that's probably 10th in line after all the providers that you've seen,
Hmm.
it's going to take some time to heal your body and help it recover back to where it used to be. And I think that patience and setting those expectations is really important, but it's really to help set you up for the rest of your life. And really, what I always say is it's building generational health because the eggs you have inside of you are really, you have your grandbaby inside
Yeah.
of you as well. So, right, you're helping take care of generations to come. And I think as women, that's really, really powerful, right? Because we're
Hmm.
tend to think very globally about our community and our world. And when you really start to think about that too, it adds another layer of meaning and intention behind what we're
Hmm.
doing.
Yeah. That's a really powerful statement. It also makes me think of my grandma and how she had endometriosis. And I'm like, did you do this to me? Which we don't know if there's a genetic factor with endo, but
Yeah.
That would be funny to think about.
I
Um, I also do want to say really quick, since we did talk, we didn't say like specific supplements, but speaking on supplements, and I know that, everybody's on TikTok, and I have fallen victim to scrolling through TikTok and like looking at, oh, okay, like this supplement can regulate blood sugar, this supplement can do this, or, I'm feeling tired, maybe I need B12. I just want to preface that with make sure you do talk to a healthcare provider about supplements before you start taking them. I have a blood clotting disorder, and I didn't even realize that some supplements can actually put you at a high risk for blood clots in that type of thing. So there could be, I don't know, everybody thinks that like just taking supplements is safe because you can get them over the counter, but
Isn't that funny?
yeah, they're like, oh, you can just go buy them. Like it's totally safe. And I'm like, well, it can interact with medications. So just make sure that you talk to a healthcare provider before you start anything yourself. But you can always
Absolutely.
go in with a list and be like, can I take these? So,
Totally. I have patients send me portal messages all the time of pictures
mhm.
that they learn about, supplements that they do learn about on Instagram. So I would
Yeah.
add to that, know why you're taking something and why it's effective for that very particular purpose that you're taking it.
Hmm.
And the internet is a wonderful place if you know how to use it. So do your due diligence about
Hmm.
figuring out what the research is to support the claims that they're making. And then you
Yeah.
can also make a really educated decision along with the support from your healthcare provider. I'm always a big proponent of really educating and empowering and becoming an advocate in the right way for your own health.
Yeah.
So I think that's a really important piece. So thank you for saying that.
Yeah, of course. Where can listeners learn more about you and your work and get in touch with you?
I'm available on Instagram, so it's just my full name, Dr. Alexis Gonzales, and my last name
Hmm.
is Gonzales. And dralexisgonzales.com is also my website. Yeah, I look forward to
Yay.
hearing from anybody that needs support.
Full, and I will also link that in the show notes. Thank you so
Perfect.
much for coming on.
Thank you for having me.
That wraps up another episode of the Chronic Chronicles. Thank you so much for joining us for this episode. I really hope that you found our conversation with Alexis as informative as I did. I learned so much about what naturopathic medicine really is. Her holistic approach to health reminds us of the power of looking at the whole picture, mind, body, spirit, and looking at the root cause of issues. When it comes to managing chronic conditions and overall well being, it can be really, really helpful to take a whole body approach to it. As always, please rate, review, and subscribe or follow to the podcast so that way you never miss an episode. If you're looking for more resources or to connect further, please follow us at Chronic Chronicles Pod on Instagram. Don't hesitate to reach out. Don't hesitate to reach out to me or to Alexis. As always, I'm here to support you. I'm here to listen. Until next time, please take care of yourself and keep advocating for the care that you deserve. Bye.